I've lived in Philadelphia, Mississippi my whole life. I love Philadelphia. My friends, family, church, community, everybody's here. You know, I'm all about a small town where you know everybody. I have 3 children. I wanted to be close to them. I wanted to basically be somewhere that I could take care of my friends and family. It's very important to me whenever I go to a hospital that, you know, I know the people that's taking care of me.
Neshoba County General Hospital was built in 1963. It served the needs for many years, but 8 years ago we determined that to go forward we were going to have to update the facilities.
In 1992, the hospital was in dire financial circumstances. With the latest emphasis, the nucleus started to roll about people getting serious and trying to figure out a way for the hospital to either, number 1, be replaced, number 2, to have an expansion of the facilities at the hospital, and 3, to expansion and renovate.
With so many changes going on in the healthcare world and so many new regulations coming out all the time, I mean, we were so limited in this small facility on the things that we could do and the people that we could take care of. We were very limited on being able to recruit new physicians into this area.
This facility means a lot to me. I started working here in '75, mopping the floor, so to speak. And the facility was aged then. We used to have to fumigate the hallways because of the smell of the sewer.
In our old emergency room, you just backed up to a door. There was no canopy, there was no protection from the elements.
The ER, surgery, and outpatient lab, x-ray, everything shared one waiting room. So the patients and the families had to share a waiting room with sick ER patients.
You'd have multiple patients come in all at once, and you had to bring the patients in through the waiting room. It was full of family members of all. There was basically no privacy.
There was no room for staff to work. There was no room for doctors to work.
You had communal rooms. Several of the rooms had more than one bed, just separated by a curtain. You shared a bathroom. Sometimes the shower would be on a different floor. Just imagine if you were a patient admitted to the hospital, you would not want to share a toilet with someone else who was sick.
We was proud of it, but it could not serve.
We had been working on this for 8 years and just never could get together the capital resources to make it a go. It's been difficult for rural hospitals to access debt markets.
Being in a rural area, there was not a whole lot of capital, but for a city and a county to not have a medical facility, it hurts in the fact that economic development can be slowed. Not many companies want to come to communities where there's no health care.
We developed a plan where we could build essential services that we needed in order to meet the needs and grow for the future, with some idea of renovating the current facility also. And it ended up being a $19 million project. With the help of the New Market Tax Credits program, we were able to get the financing in order to be able to do the project. This program, in my opinion, is just a lifeline for rural hospitals. The expansion of our hospital was a $19 million project, a 2-story building. On the first floor was an ICU, a new emergency room, and a new radiology department. On the second floor were 25 new patient rooms. They're absolutely beautiful, very large. A new surgery department and a new pharmacy. Directly across from the new hospital, it's attached by a walkway. We have renovated part of the first floor of the new hospital for a new laboratory, a new respiratory therapy department, and sleep center. We have a new CT scanner. We have 2 new x-ray rooms, a helipad that is just right where the ambulances unload patients, which is a very nice covered area, very large. There can be 4 ambulances that are parked at one time.
We've expanded to 8 PACU beds where 4 we admit and 4 recovery, 8 total. GI room, a procedure room, and 2 ORs. The ER has their own waiting room. X-ray, all outpatient services has their own waiting room as well. And then surgery has a waiting room outside the surgery department for surgery patients.
I'm Dr. Julia Riley, pediatrician at Neshoba County General Hospital. There was no pediatrician in Neshoba County, and what parents, and still come into the office to this day and say, oh, you know, we're so glad that y'all are here, because before, you know, if my child was sick, I was on the road to Meridian, it's about 35, 40 miles away, or to Jackson. And so a difference between being able to, you know, make a stop in, see how things are going, make a plan if things aren't going so well, or do some reassurance and guidance or well checkups, can really all be done as part of sort of a daily part of their lives instead of a really big journey out of town.
I live here in Philadelphia. I'm actually only about 2 miles from the hospital. I have a disease called scleroderma, which is a slightly rare disease. Not very many people have it, and I needed infusions to help relieve the symptoms. I was searching for a home infusion company that would come to Philadelphia, and I had talked to a couple of them, and I just couldn't get them to come to Philadelphia. They couldn't get through with my insurance. They couldn't find someone to come into the Philadelphia area. And then I read in the paper where the hospital was expanding and they had added an infusion center, and I said, this is exactly what I need.
The biggest example is here recently we had a devastating tornado in Louisville, Mississippi, just up the road from us. Their hospital was hit, had to be evacuated. And we were unloading 3 ambulances at a time, multiple critical patients in the ER all at the same time. Being
this close, being prepared with the new emergency rooms, the new amenities of this place.
We all talked about it that night in the ER, of how much nicer it was to do this here than it would have been in the old hospital.
It's a wonderful community thing that we do not have to go out of town to get the services we need. We can do it here in our own community and get wonderful care.
That's a reality now. We have a wonderful facility, and we've got the physicians and expertise to utilize the equipment in that facility to make it a reality for the people. It's what they need in order to attract people into their businesses and into our town. And if we want our town to continue to grow, the new hospital was a very important part of that. It was a very huge piece of that puzzle. I think that the hospital is the heartbeat of the community.